Good afternoon, and thank you for coming to the meeting today. My name is Ann Lorum. I am the RN case manager for the Miller Parkway Clinic at Occupational Health, and I am here to talk to you about the strategic goal for the Occupational Health Department, which is to have consistency in scheduling appointments and optimize the time of the providers and the medical assistants and increase their productivity. Aurora Healthcare is a not-for-profit organization based in Wisconsin. We pride ourselves on state-of-the-art diagnosis and treatments to meet the customer's needs. Aurora Healthcare is a diverse company that works with its employers and employees to deliver high-quality care to the consumers. Our corporate advantage is to lead, innovate, thrive, and engage. Dr. Nick Turco does mention over monthly messages on our webinar that there are responsibilities that we have as a company to our customers. And with that, we have a corporate culture. We have our caregivers. We do have a mission statement, shared governance for the nurses. We use teamwork across the department and within the department. We have Aurora Stars for individuals that go above and beyond performance. Our Aurora Partnership Campaign for donations to the community and back into the volunteer sites, and innovation. When we look at the SWOT analysis for the Occupational Health Department, we look at areas of improvement, weaknesses, opportunities, and threats. With the analysis, we are committed to our strengths of offering a variety of tests for our workers, high commitment to the coordination of care within our ancillary departments. We have a diverse medical staff from the medical doctor, mid-level physician assistants, to the RN, LPN, and MA. We have competitive pricing within our department. The weaknesses: the staff have varying degrees of certification. Our medical assistants are all not certified. Our department may not always have an MD on site. It may be a mid-level PA. We're operating our clinics with hours that are not in line with our client hours. We have inconsistency in the scheduling process across the clinics from the north of part of Wisconsin down to the southern part. And private insurance is not accepted, so it limits the resources. The opportunities, both external and internal, is to implement a website for employers to check results, appointments, or certifications, to have the hours of availability for working clients in line more with our department, and offer primary care referrals to any workers that do not have a primary care doctor. Threats that are seen: competitors are within the 10-mile radius at some of our clinics. Our competitors have resources all at one site. We lack employers in the area that may have workers. Sometimes the companies are on a shutdown during downtimes of the year. And the reimbursement charges decrease under the workers' compensation insurance. With the stakeholders analysis, we want to make sure that we are using communication with them, both formal and informal communication. So with the stakeholder analysis, we want to keep an eye on keeping the doctor satisfied, the employees, both internal and external, the managers of the departments, and then the employers. We want to manage closely the medical assistants, the licensed practical nurses, and the patient service reps. By doing this, we make sure that the patient service reps have an accurate scheduling. The medical assistants or the LPNs are able to spend the appropriate time with the patients. Monitoring at a minimal effort would be the medical director and the manager or the supervisor of the clinic, and keeping informed both internal and external employees. When we look at the workflow process, again, I did mention the communication, formal and informal, to kind of know what's going on. So we'll implement the workflow process. We'll do a time study for accuracy for scheduling. We'll reevaluate based on a daily process. So as the implementation takes place and goes on, we will reevaluate that process from a daily to maybe every other day to a weekly and then to monthly. And again, going back and making sure that we are following back through to make sure the process is working. Accountability and level of production will be on every level, from the MD, the PA, down to the RN, LPN, MA, and patient service rep. Patience and growth in the department is what our outcome is to be seen. With the internal process, we want to improve the scheduling to see more patients. We want to have the appointments that are filled more timely. Each clinic will follow the same process, so we are doing everything consistently, and we'll decrease the overtime by the medical assistant who may be the last one working for the day and have a patient that showed up late or the physician was behind, so it'll kind of decrease that overtime expense. When we look at customer service standards, we are going to do a benchmark on this. We are going to use prior implementation and then after implementation. It'll match 2017 and monthly for 2018. We will look at patient satisfaction, appointment availability, employer availability, staff use of extra time, and compare and contrast with our benchmark. With the financial benchmark for 2017, we have our budget already determined. For 18, we'll do a month-to-month comparison, and we'll look at increased scheduling volume, staff productivity, the downtime of the staff, managed overtime, and increased clinical revenue. With that, that is the strategic goal for consistency in scheduling with the rationale. And if you have any questions, I'd be happy to help you at this point in time. Thank you.